new study shows that high-intensity physical training, such as weightlifting, can improve sleep quality and anxiety in adults with post-traumatic stress disorder, or PTSD. PTSD is a mental disorder resulting from exposure to severe trauma. If you have PTSD, you are at a much greater risk of developing a number of other mental health disorders, including anxiety, depression, eating disorders, and substance abuse. Researchers have found that people with PTSD are about 6 times as likely as someone without PTSD to develop depression, and about 5 times as likely to develop another anxiety disorder. Because of nightmares, PTSD sufferers may also suffer from sleep disorders. While there is no cure for PTSD yet, research shows that physical remedies such as intense exercise may help those suffering from PTSD. So, how does exercise help PTSD patients? In a recent study, researchers recruited 22 individuals who had suffered at least one traumatic event in their life and had been screened positive for PTSD. Participants in a resistance training group performed 3 30-minute high-intensity training sessions per week over the course of 3 weeks. Meanwhile, the control group focused on various topics unrelated to exercise or PTSD for the same duration of time. Both the groups showed similar reduction in PTSD symptoms. However, those in the resistance training group had greater reductions in anxiety symptoms and improvements in sleep quality compared to the control group. This is not the first study to show that exercise can improve PTSD symptoms. A study found that 2 weeks of stationary biking can be helpful in reducing PTSD symptoms and improving moods. In another study, researchers showed how exercise and physical activity affect combat veterans diagnosed with PTSD. Veterans who performed physical activities in addition to usual care showed greater improvements in symptoms of PTSD, depression, anxiety, and stress compared to those who received usual care alone. While researchers are not exactly sure how exercise affects the psychological health of PTSD patients, they have some theories to answer this question. First, strenuous exercise stimulates the brain's release of endorphins. These chemicals are the feel-good hormones of the body and are responsible for the phenomenon known as a runner's high. Exercise can also suppress and reduce the levels of stress hormones in the body and can help treat mild to moderate depression as effectively as antidepressant medications. And, of course, it does so without the side effects of those medications. One study showed that running for 15 minutes a day or walking for an hour reduces the risk of major depression by 26%. In addition to relieving depression symptoms, research also shows that maintaining an exercise schedule can help prevent you from relapsing. Strenuous exercise tires the body so that sleep comes more easily. This is a huge benefit for sufferers of PTSD. Exercise also affects the variations in your heart rate, which are linked to higher levels of emotion-focused coping, an ability disrupted in those with PTSD. Finally, exercise delivers intrinsic benefits, such as improved self-esteem and increased feelings of control over one's own body, which can greatly help those suffering with PTSD. The brain and mind aren't separate from the rest of the body, and mental health isn't removed from physical health. They are a part of the same system and they work together. It's important not to neglect either area and to keep in mind that what you do to treat one can, and often does, impact the other.